If you try and make an appointment with a psychologist or a mental health professional for yourself, perhaps for your children, chances are you'll have to wait and it'll be expensive. If you make a phone call to 000, in 170,000 cases over the course of the last year, that call to 000 related to a mental health crisis. The need for support and services is real. How well are we travelling as a state to improve mental health outcomes for Queenslanders? That's been the focus of an inquiry. The report on it was released yesterday by the Queensland Parliament Mental Health Select Committee. Jennifer Black is the CEO of the Queensland Alliance for Mental Health, which is the peak body for community mental health and wellbeing. She's been poring over that report. Jennifer, good morning.
Good morning, Rebecca.
Let's just take a step back. What was the kind of the call to action to prompt this inquiry in the first place?
It was probably a bit of a surprise when they announced it, to be honest, because we've had a number of inquiries that have been telling us what's wrong with the mental health system across the whole country. But I guess they wanted to have a look. We'd just seen the Royal Commission in Victoria, and I think Queensland wanted to take a look more deeply about what was happening in Queensland.
Joe Kelly, who chaired the inquiry, the Member of Parliament, I'll just read the opening lines in the forward of the report. Joe Kelly says, "I acknowledge all the people with lived experience of mental ill health, suicidality and alcohol and other drug issues. It would be rare to find someone in our community who has not been impacted by one or more of these issues. The impact on the individual can be enormous, frequently fatal, and the impacts on families and society cannot be underestimated." That's not new information to you or any of the frontline services you work with. How confident are you that another inquiry is actually going to produce tangible results in this space?
Well, I think the beauty of this one is it's about Queensland. And one of the really genuine things that I read when I read those opening statements is around a real acknowledgement that we haven't had the investment in Queensland that we need. In fact, what they're saying is our investment has been lower than the national average for 10 years and the lowest in the country in 2019 and 20, which is quite astounding. So it's no wonder some of your callers can't access a service because we're not investing in it.
Queenslanders had the lowest per capita expenditure on mental health services in Australia in the last year. Why?
Well, that's a good question. But I think what this report has done, this inquiry has done, has acknowledged that that's the case. And actually, it's actually asking for investment across the board in a whole range of things, which if enacted, is absolutely positive. Obviously, it's going to cost.
Yes, and if enacted being the key word in there. So off the back of that sort of revelation there in terms of low expenditure on mental health, there are 57 recommendations in this report. Jennifer, what stands out to you?
So we put a submission in to the inquiry. We represent the community organisations, so they're not-for-profit organisations that often run on the smell of an oily rag, if you like, but they're providing services to people in the community. So one of the really big things for us is that they're talking about alternatives to emergency presentation, and we know from all the other reports and inquiries that emergency departments aren't the right place to go when you're in mental distress. They're quite stimulating and busy environments dealing with multiple things, and people need time and space and, quiet spaces to talk to someone and calm down in that instance. They also need to be able to go somewhere in their community when they're first in distress, not wait until they're in crisis to actually get some help. So it's actually talking about that, and it's talking about increased investment into community organisations like ours, and that alternatives to hospital admission. They even use some of our terms from our some of our language from our submission, which is warm entry points, because people find sometimes having to present to a hospital quite confronting.
They should be using your language, though, right? Yeah. You're the experts. Yeah. You're the ones on the ground. And I mean, that goes back to that point that the report revealed that Queensland ambulances receive 170,000 calls every year from someone experiencing a mental health crisis. 170,000. That's not to say that some of them don't need to go to an emergency department and receive hospital treatment. But do you have any sense of what the division might be for someone who might go to an alternative space, a warm entry point, as you call it?
Well, we have to create them first, don't we, for people to go to. But it's interesting you say 170,000. So this report also talks about 150,000 people in Queensland alone that they think are missing out on care altogether. So it's not surprising that your callers are, ringing to say that they can't get help. They know that. They've acknowledged that in the report, and that's why they're suggesting there needs to be significant investment to help those people who can't be just managed by going to see a GP and probably aren't sick enough to get into the hospital system. So they get turned away and then there's nothing for them.
Yeah. And then in some cases it does reach crisis point,
yeah,
and that doesn't help anyone at all, and it also puts pressure on hospital emergency departments.
Yeah.
Do you have the support of the kind of, mental health is your area of expertise, but more broadly in health, are there other areas championing the idea of creating a dedicated funding stream for mental health?
Yeah, I'm not sure if others are, but that's actually something that this report is talking about. My understanding is that the government will now look at these recommendations and then let us know how they're going to respond to them. So that's really the key thing, isn't it, about what that stream of funding would be and how they're going to prioritise the quantum that's outlined in this report.
Is that your diplomatic way of saying, show me the money?
Absolutely. Show us the money. Mm. And why wouldn't we prioritise people's mental health? We've been talking about nothing else for the past 2 years throughout the pandemic. We know that people have been distressed and they haven't been able to get the help that they need. Isn't it time?
Isn't it time? That's the question Jennifer Black, the CEO of the Queensland Alliance for Mental Health, is asking of the Palaszczuk government. So are you talking about the next budget that's handed down in a couple of weeks' time?
Well, they've got an opportunity. The cynic in me says that they might already know what they're going to fund, but this report has come down 2 weeks prior to them announcing the budget. We've put a submission in and we've asked for some of the things that are in this report. So there's an opportunity really for them to actually invest in mental health in this budget. And I think they need to, given the pandemic. Is
there anything in the report that you clearly see from your submission that you feel confident will be addressed?
Well, we haven't been able to get any traction on what they're actually going to put in the budget. It's
right.
A tightly held secret, but we've certainly been advocating for some of these things. So they do know that's what people are asking for.
Yeah. One of the other areas that came up in the report was improving access to affordable housing, which is another issue we've been talking about a fair bit, in particular over the course of the last 12 months or so. Are there parallels between, funding and ramping up resourcing for public housing and also addressing mental health services?
Absolutely. It's one of the things that keeps people well is having stable, affordable housing, a roof over their heads. And we know during the pandemic, particularly regional parts of Queensland, there was an increasing homelessness population because rents were increasing and people were coming back to their homes and their holiday homes and that sort of thing. So people were getting squeezed out of the housing market. Mm. And once you've lost your job, lost your house, it takes a bit to get that back up and running.
Yeah.
And so what they've talked about in this report is not only housing stock, but support for people to maintain and sustain their housing.
Mm. And I think on a day like today, when the Reserve Bank's going to meet this afternoon and everyone's sort of bracing themselves at the advice of the Treasurer for interest rate rises,
yep.
I mean, we're all just a couple of steps away from, a job loss or a dramatic health event or trauma that you weren't expecting to find yourself in a pretty challenging situation. I just want to go back to the idea. So you said in the last, what was the figure you said in terms of health funding in Queensland for the last 10 years?
Well, we were, but the report actually outlines that Queensland was lower than the national average of investment in mental health, lower than the national average for a decade.
So what does that translate to in practical terms? Is it we don't have the workers in that area, we don't have physical spaces for people to go to? What does that mean in practical terms, that lack of investment?
Well, I think it means a lack of services, and I think there've been probably a lot of callers to your show who are talking about not being able to access a service. If they're not funded, they're not there.
Yeah,
and particularly the community-based services, because you've got the hospital system and the GPs that you can go to, but it's really all that bit in between that supports people to stay well in their communities, or is an access point for people in their communities. People don't really know where to go in the current system. It's hard to navigate a service, hard to navigate where you would get the best help from.
Yeah.
And sometimes people just want advice about what to do next. And that's not easy.
Yeah, and even having the confidence to know that, there's an obvious phone number to pick up to. Is there a compare and contrast we can do to another state or territory that is funding or resourcing mental health well?
Well, I think we've got to take the lead from Victoria. They had a Royal Commission. We've seen significant investment. I think it was something like $3.8 billion that they've invested. They've done the levy.
What's the levy?
Don't know the full details, but the levy is on big business that funds the reforms that they've needed in Victoria.
Right. So there's a levy on business in Victoria that funds
the reforms. Yeah.
And state resourced funding comes from there.
Yeah.
Wow. Is that something you'd like to see in Queensland?
Oh, look, I think people are always going to be challenged if there's an extra levy, but I would like to see the government prioritise mental health. Because, the bucket is always small, isn't it? So it's about how you prioritise it too.
And Jennifer, it's also about how you frame it, because you can have a treasurer at any level talking about productivity and well-being and labour being available. So once you start putting it through that prism in terms of mental health and how people are coping, it turns into a very strong economic argument, doesn't it?
Absolutely. Mental health is everyone's business, and we know that, so clearly through the pandemic. I've never, in my whole career in mental health, heard so many people talking about their mental health and wellbeing. So it affects everyone. Everyone in the workplace. Productivity is dramatically decreased by people's mental health. So I think it is everyone's business. It's business. It's the whole community's business to improve people's mental health.
At a time when there will be a lot of industries and advocacy groups, looking at the treasurer, looking at the budget come June 21 and saying, we need help. Did that idea of a levy on big business come up in this report?
It talks about a funding stream. It talks about a dedicated funding stream for mental health. So I'm not quite sure how they're going to interpret that and how they're going to manage that.
Yes.
But it's certainly what they're asking for in this report is an extraordinary investment of money.
Do they put a dollar figure on it?
No.
So we don't know if it's to the tune of Victoria's $3.8 billion then?
No.
Okay, well, that's to be revealed, and you, like many in the sector and the community, will be looking to the June 21 Queensland budget and seeing what comes forward. In the meantime, Jennifer, very briefly, if people are feeling like they need to reach out for help, can they have confidence in the community organisations that you work with?
Yeah, look, I think it's tricky to access a community organisation because of the way the funding is in our state, and often people need to go through a clinical service, so a hospital system, before they can access a community service. So we've been really advocating hard that people should be able to enter into a service in the community as a first point of call, not after the event.
Yeah. Good to chat. We'll keep in touch. Thanks so much.
Thank you.
Jennifer Black, the CEO of the Queensland Alliance for Mental Health. They're the peak body for community mental health and wellbeing.